So Gaze just brought up a question that a lot of people aren't sure about what these buttons mean. So these are the sensitivity. So most of the sensitivity, well, it's always set up so that to be on this middle one. So the technical people will set it up, they can set it on low, medium or high. So for example, for low, you might choose a low sensitivity for a children's hospital. So in other words, the AEC chambers will cut out earlier than normal. This is the regular one. And high, for example, it could be some hospital that wants really high def pictures. Maybe there's one doctor who wants high definition. So if you press that button and use it, it would cut off at a slightly higher dose, giving you a better quality image, but more dose. The density, let me just choose pelvis. So with the density, if you push these up, it's supposed to be about 25%. So if you have +3, you'll get double density on your film, and if you have -3, it's about half. So it's just a way, I guess, if you were doing something like a nasogastric tube, which requires a little bit more penetration than just a normal chest X-ray, you can make that go higher or lower. It only goes to +4 or -4. So it will give a reasonable amount of difference to the image. So it goes a little bit more than double and a little bit less than half. The one down the bottom, to be honest, I don't know how much value it is, because when they can change it to bigger patient or smaller patient, but they're only it just changes the KV. So if you can zoom back a bit so you can watch the KV change. It changes the KV just so that your MAS or your time is kept a bit shorter, but it doesn't go, it's gone from 77 down to 65, so it's about 12 kV between low and high. It's just as quick to also do that as it is to, press that one. So it's just a way of a supposed short way of changing your KV up or down so that your time, could be shortened if they were a bit on the large side. So yeah, that's it. Any other buttons that, and the other one that you might want is the 80%, 100%, and that's just purely tube loading. If you had a big person, you might want to use 100%. It'll get more output, but your tube life is shorter. So that it's always on 80% by standard, just to make the tube longer. And also, this is a way of flicking between generator and position. Now, this has not got any pre-programmed positions because it's a manual machine, but if it was fully automatic, it would have, one would be chest, another one would be C-spine, whatever, and it would have a matching picture, etc. And it's all programmed in, and all these angles and distances, they'd self-populate, so you'd have your target and then your actual, but it's just not relevant in this one.